Hi everyone, this is our legacy project, how to take panoramic radiographs. My name is Cindy, Quinn, and Jessica. First, perform hand hygiene and don appropriate PPEs. Obtain the radiographic prescription and explain the procedure to the patient. Ask the patient to remove glasses, earrings, necklaces, hairpins, removable appliances, or any metal objects that could interfere with the image. Place barriers on equipment following infection control protocols. Set up the machine and turn the unit on.
Confirm there is no eyewear or jewelry being worn. Ensure that there is the correct settings for adult size, arch, and the radiographic exposure is on. Prepare the bite stick. Show the patient where to bite on the divot with the central incisors. Have the bite stick face the patient for the correct placement. Ensure the equipment is at the patient's height. Instruct the patient to bite on the bite block on the groove with their anterior teeth so the arches sit correctly on the focal trough. Ensure the tongue is touching the roof of the mouth. Remind the patient to remain absolutely still and avoid swallowing. Press the exposure button to begin the panoramic cycle as the machine rotates. Step behind the protective barrier or leave the room while maintaining visual contact with the patient. Ensure everybody in the clinic is 6 feet away. Remind the patient to maintain absolutely still and avoid swallowing. Press the exposure button to begin the panoramic style as the machine rotates. Make sure to say X-ray for your colleagues. The panoramic X-ray is now complete. Make sure to save the panel. Make sure to turn off the radiographic exposure. Remove the apron and give the patient back her belongings. Remove all barriers. Wipe down all the equipment used for the procedure. Turn the unit off and ensure that the sterilization bag is labeled correctly following the clinic guidelines. Follow proper hand hygiene. Make sure the operatory is placed correctly, the arms are not sticking out.
So common errors we see is chin tip too low. So what you want to do is raise your chin, aligning the Frankfurt plane parallel to the floor. Chin tip too high, lower your chin, aligning the Frankfurt plane parallel to the floor. The patient is too far forward, make the patient slightly back. The patient is too far back, move the patient slightly forward. Tongue not on the palate, instruct to press the tongue to the palate and close the lips. Patient movement, remind the patient to stay still. Ghost images, remove all metallic objects.